Have you ever found yourself in the room of a medical profession asking for their advice over your child's condition, and you walk away not so sure if they know what they're doing? Or worse, you spend months in their medical center or their therapy center getting treatment only to find that nothing really has improved for your child? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share with parents out there some simple tips on how to empower yourself when speaking to a health professional about your child's condition. Now, here at My Favourite Physio, we see lots of little ones. And recently, in the last few weeks, we've seen some families come through with very distressing situations, which could have been prevented if the right therapist, the right diagnosis, and the right intervention was done for their child. And unfortunately for some families, we can't turn back time. So the consequence of not getting the right treatments at the right time has impacted their child's future and health and well-being. So I thought I'd jump in and share this. Now, if you're concerned about your child, say for example, you're worried about your baby's clicky hips and you see a medical professional, you need to be able to ask them if they have seen something like this before. So you ask the health professional, have you seen babies with clicky hips before? Do you know why baby has a clicky hip? How many babies with clicky hips have you seen? What was the outcome of the treatment for babies with clicky hips from your treatment? What will happen if we don't treat my child with clicky hips? If they're not able to explain to you the condition specifically and confidently and give you evidence-based results of research on what we should be doing, what we should not be doing, so that you feel informed and confident of the therapist, then you need to walk away and find someone else. Because if you don't, the consequences can be quite long-lasting for your child. So we've had a family say to us that they were concerned about their child's hips right from day one, had scans, had x-rays, had everyone looking at them, and yet now when they've presented to our clinic at 2 years old, their hips x-rays at 2 indicates that their hips are not well developed. So we have missed the window of opportunity to actually treat her child's hip when they were 6 weeks old, when they were 12 weeks old. Now at 2 years old, the child is looking at probably needing surgery. Now that's devastating for any family to have to face. So I'm really passionate about this. If you are concerned about your child, you go to a therapist, they're not able to explain to you confidently about what they know about the condition or whether they've seen a child like yours and what the outcomes are. If they cannot explain to you confidently the treatments they have and what you should do or not do, then it's time to move on. We've seen babies come to us with torticollis, tight neck muscles, seeing wrong professionals who misdiagnose them, or worse, traumatize them by stretching and pulling their heads and necks in all directions that the child will no longer tolerate anyone touching them, not even their parents. Now, that's not on and that's not acceptable. So, if you're out there, you're concerned about your child, you've gone to a few therapists, you're not seeing outcomes, or you're still worried because in your heart of hearts, you just don't feel right about that answer they gave you, why don't you ring us here at My Favourite Physio? Speak to one of our expert pediatric physiotherapists about your child. We're more than happy to have a chat without any cost, just so that we know that your little one is well taken care of. And if we can help, we certainly would. The number to ring here at My Favourite Physio is 02-9790-4233. And if you know somebody out there who's just been really concerned about their child and not satisfied with the health professional's answer for their child's concern, why don't you like and share this video with them? Until next time, have a fantastic day. Bye.